So as you guys know, I'm Katie, and I'm what's known as a female to male to female detransitioner. And what that means is that for a period of time, I identified myself as transgender, a transgender male and biologically female. But then after a while, I started to regret that identity, and I went back to identifying myself, my biological sex, as a female. And that's how I got the title Detransitioner, because now I'm taking steps to go back to living as a biological female. Now how did I get there? How did I come to the conclusion that I might actually be a man? Well, when I was a teenager, I was in high school, and I started identifying myself as a lesbian because I didn't feel that I was as interested in the guys at my school as I should have been. You know, I was 15, 16 years old. A lot of the girls my age were getting their first boyfriend, and I just wasn't interested in that. So I asked some of the upperclassmen at my school, you know, what does this mean for me? I don't think that I'm as interested in the guys as everybody else. And they said, well, it's okay, we have a test that we can put you through. So they asked me one question. They said, can you picture yourself sleeping with the guys in our class? And I looked around the room, and I gave a good solid no, I cannot see myself doing that. And so that officially made me a lesbian. So that's how I got my identity. There were no other questions, that was it. It was a pretty easy test. So I concluded, all right, great, I'm a lesbian, you know, I'm a little bit of a tomboy too. I like sports, I'm very athletic, so this just fits. And I did date girls here and there, but it just felt kind of awkward. But all in all, I really did think that the lesbian identity was good for me. Until I got to college. My freshman year in college, I started to feel really uncomfortable. Here I am, growing into womanhood. I feel so uncomfortable about my body, all the changes that I've been through during puberty. And I started looking on YouTube, looking on the internet, but mostly YouTube, to see why I was feeling like that. Why do I feel so uncomfortable in my body? Why do I feel so uncomfortable growing into womanhood? And I came across some YouTubers, some other teenage girls, maybe they were 18, 19 years old, right around the same age as me, identifying themselves as boys. And I thought, oh, that's really interesting. You know, I've been a tomboy my whole life. I'm a lesbian now, so if I'm dating girls, I'm basically doing what boys do anyway. So I decided I'm going to identify myself as a male, the same way that these YouTubers are, because they look so happy in these videos, and I wanted to look like that. So I started identifying myself as a male, and I went through a social transition. So I asked everybody in my life to call me by a boy's name and use male pronouns to refer to me. And everybody did. Nobody knew any better. This was back in 2014. And I think I had just turned 19 at the time. Maybe I was still 18. It was toward the end of the year. My birthday's in September. So I started identifying myself as a transgender male. And that identity felt really good. It felt like I had escaped womanhood, like a huge weight was lifted off my shoulders when everybody started calling me he, him instead of she, her. So when that really stuck and when I felt really solid in the social transition, I went to my doctor and I told her, you know, I've been identifying myself as a male for about a month and a half now, so I'm ready to start medically transitioning. And she referred me to a gender clinic down in Boston. And I went to the clinic and they were able to start me on hormones without any issue. They started me on testosterone. When I went, my biggest concern that I told the gender clinic was that I don't have a therapist, and I was afraid I needed a therapist for at least 6 months to get the testosterone. And they said, yeah, that's technically true. I'm supposed to have the gender dysphoria diagnosis for at least 6 months. But if I've been feeling this way for at least 6 months, that'll cover it, and I can start on the hormones without a therapist. And so that's exactly what we did. I was able to start on testosterone without any issues, without a therapist, without anybody approving it, just the gender clinic saying, yep, you're good, we diagnosed you with gender dysphoria, and it seems like you've had the discomfort with your biological sex for at least 6 months at this point. So I was good to go. And I started taking testosterone when I was 19, so right after I socially transitioned. I actually held it off a little bit longer because I had finals. I was in college, and so I had finals. And so I waited to schedule the appointment to get the testosterone. But if I didn't wait, if I hadn't waited, I would have gotten them even faster. But all in all, it was about 6 months between identifying as transgender and starting on the hormones. And that was me, elongating the process. so that I could focus on my schoolwork for a little bit longer. So I started on testosterone, and the first effects that I was noticing was my voice started getting deeper. Well, it started cracking all the time. Like I couldn't say one sentence without my voice just cracking and no sounds coming out anymore. But it started getting deeper. And so I felt like, okay, now I actually sound like a boy. I have short hair. Everybody's calling me a boy. I was still young. I was 19, so I still looked pretty neutral. I hadn't grown into this, beautiful feminine shape just yet. And so I looked like a young boy, and people would mistake me for a 12-year-old boy, even though I was 19. And some of the other effects that I noticed at first, my hairline was a little bit different, so it looked a little bit sharper with my haircut. I started to grow a little bit of facial hair, especially on my upper lip. And my shoulders, really all my muscles, but especially my shoulders, were a little bit more rounded. So I just had a more masculine appearance just overall. And that was just in the first probably 6 months of starting on testosterone, but you could really see it after a year. And my voice was more stable after a year, so it wasn't cracking as much. After the first year on testosterone, I was so excited from all the effects of it. There were no new effects. It was all the same ones at that point. I was used to it. So I was ready for top surgery. And top surgery for biological females is a double mastectomy, where they remove your breasts entirely. And a lot of breast cancer patients have a surgery just like that. So I went to the gender clinic. This was exactly a year after starting the hormones. I went to the gender clinic and I told them, I'm ready to have top surgery. Again, I didn't have a therapist at this point. So the people at the gender clinic said, all right, that's not a problem. We'll have you sit down for an appointment with our in-office clinician. Maybe that's what she's called, I'm not sure. But she basically took the place of the therapist. So I was not, I never saw a therapist at this point, but she was able to sign off on all the mental health information, that I was ready for surgery, that I knew what it was about, and that I knew all these different things. That she'd been seeing me for a year at that point, which she hadn't been. It's just that I'd been going to the clinic for a year. So technically I was a patient where she was a provider. So she signed off. I've been taking the hormones. I've been living effectively as a male, and the only known intervention at this point is surgical. So she signed the letter, sent it over to the surgeon, and I was able to have the double mastectomy later that summer. So about a year, 3 months on testosterone, I had my healthy breast removed. I was 20 years old when that happened. Fast forward a little bit, because the next few years, nothing really happened. I had a flat chest, I had all the effects of testosterone. I was about as happy as I thought I ever would be, about as happy as all the girls in the YouTube videos that I was watching. But about maybe 3 to 4 years on testosterone, I started having serious abdominal pain. And it was to the point where if I was outside, I was playing basketball with my friends or something, I would just be in so much pain, just all of a sudden it would hit me and I would be doubled over and I couldn't stand up straight anymore. So I would just be out of the game, no more basketball that day. And I loved playing basketball, so that was really devastating. But when I went to the gender clinic to find out exactly what was going on, they said that the testosterone has, a terrible effect on your reproductive organs. And what it was uterine atrophy, which means that the muscles around my uterus were weakening. And because of that, they were sort of shriveling up on themselves, that when I would try to stand up straight, the muscles would pull on each other, and it would cause that sharp pain in my abdomen that I was feeling. And so that's why I had to stand over like this, crouch down, to alleviate some of the pain. So when I went to the gender clinic and they told me that that's what was going on, that my uterus has been destroyed by the testosterone, though they didn't say it in quite those terms, that's effectively what they were telling me. They said that they recommend for their patients in this situation to have a hysterectomy. That every person, every woman who takes testosterone for a long period of time, usually 3 to 5 years, you end up needing a hysterectomy because of the damage done to your reproductive system. So that's exactly what I did. It was the summer of 2020, and I was 24 years old, and I went in to have a hysterectomy. They removed my uterus, cervix, fallopian tubes, and both ovaries. And they did tell me, before I went in for the surgery, you know that you'll never be able to have kids. But my response to them was just, well, men don't give birth, so why do I care about that? It just wasn't, clicking in my head exactly what that meant. So I had the hysterectomy, but during the surgery, well, technically after the surgery, I came out of it, and they put me in the recovery room, but I just kept getting worse and worse. I wasn't getting any better, not even close. And later that night, the surgery was in the morning, and later that night, my condition was so bad that I started losing consciousness. I was just in so much pain, I was getting sick, and I just started losing consciousness. And that's when the nurses did an ultrasound, and they saw that I had blood pooled in my abdomen. Because the doctors, one of the surgeons, he cut open one of my arteries, and so I actually don't know, full transparency, I have no idea if my artery was supposed to be open, if it wasn't supposed to be open. It sounds like it wasn't supposed to be, but I won't pretend to know the details. Anyway, one of my arteries was open and left open. They put me in recovery. I was bleeding internally that whole time, so that entire day. But it was a slow enough bleed that it took the whole day. But when I started losing consciousness, my blood pressure was decreasing, my heart rate was increasing, all the signs were there. They did the ultrasound, saw that I'd been bleeding out, rushed me back in for emergency surgery. They fixed all their mistakes in the emergency surgery that night. And then I had 3 blood transfusions, and I was able to go home either the next day or the day after. It's still fuzzy, I actually don't know. And I always bring that up because you think, you're going in for a pretty routine procedure. Anything can happen in surgery, any surgery, not just a hysterectomy for somebody who's transgender. I bring that up because surgeries come with a risk of death, and people are dying from transgender procedures that are not medically necessary. And the argument could be made that my hysterectomy was medically necessary because of the damage done to my reproductive system. Maybe not. I don't know what would have happened if I just stopped the testosterone. But I always, bring up that story so that people realize just what the risk is when somebody's going through the transgender process. It isn't just they're a little bit confused and they might be confused for their whole life now. The risk is death. But anyway, I came out of the hysterectomy. I have no lasting effects from that. I made a full recovery. Went back to work with no problem. I think I had to stay out of work because of the emergency surgery and everything that happened. I was out of work for either 10 or 14 days, and I was just so bored. I watched Star Wars. I never watched Star Wars, but I did. I did. It was awful. I don't like science fiction very much, but that's how bored I was. But anyway, even after everything that the hysterectomy put me through, that's not what changed my mind for the procedure. So I was 24 years old for the hysterectomy, and I didn't start even rethinking the transition. Was this wrong? Until it was about 6 months later. So I was still 24 years old. And that's because I just went for a normal haircut appointment. I went to my barber, and my barber, she's very talented. Sometimes she'll still cut my hair, but not as often. And she gave me my regular haircut. I've been getting the same haircut for years. There was no issue with it. I was satisfied, left the barber shop, went home, was going to clean the hairs off the back of my neck so I wasn't itchy when I went to work later that day. And I was just looking at myself in the mirror, looking at my haircut, yeah, it looks good. But I was just staring at myself in the eyes, and finally in that moment, I saw myself as a woman. And I had never seen myself as a woman prior to that. Because when I was finally becoming a woman, I abandoned it, and I tried to turn myself into a man. So that was the first time in my life that I was able to look at myself in the mirror and actually see myself for who I am. And it stuck with me because I didn't look like a woman. Nobody passing me on the sidewalk would have thought that I was actually a woman. So looking in the mirror, thinking I look absolutely ridiculous right now, it still sticks in my brain to this day because I was seeing something from years ago. I wasn't seeing the Katie who had transitioned. I was seeing Katie before the transition. And so that experience just really stuck with me, kind of stayed on my mind. And that's when I started rethinking my transition. And I thought, maybe I'm going down the wrong path here. So I spent a couple of months just ruminating on that. And then I finally decided I'm going to go to church. So I was raised Catholic, so I went to a Catholic priest. I did a confession with him. And that priest was very good. Everybody asks me, well, did he give you good pastoral care? He did. He even blamed his own generation. So he kind of took a lot of the burden off my shoulders, just in that sense, to say that maybe I had some parts in it, but it wasn't all my fault, what had happened to me. And from the confession, the confession, the absolution, and the penance. It was a Catholic church. From there, I started reading the Bible more, just being in God's Word and letting it shape me. And I always fell back on the fact that I'm baptized. I'm a baptized child of God, and if that's the only identity that I can hold on to right now, if everything else falls apart, then that's enough for me. That's more than enough. That's all I really needed. So I joined a church a little bit closer to my work. It wasn't a Catholic church. I joined another church maybe about 4 months after that, maybe 6 months after that. And I sat down with the pastor. I was not detransitioning at this point. I was kind of off and on, not really sure what I was going to do. But I sat down with the pastor and told him what was going on. I said, I'm transgender. I forget exactly how I said it, but I basically told him I'm transgender and I don't want to be. And kind of caught him off guard, being a pastor, sitting in your office, having somebody walk in and just say, I'm transgender, I don't want to be. You're not always expecting that. But his response was perfect. No, his response was good. And he kind of challenged me a little bit. He wanted me to go back to using my birth name, Katie, even though I wasn't totally sold on it yet. So I asked him, can I just be Katie at church? And everywhere else, I don't have to tell people that I made a huge mistake and I'm turning around. And he said, you can just do it at church, that's fine. He said, you can be anybody you want to be here. We want you here. So that was great. And from there, I started challenging that internal dialogue that's telling me, you're actually supposed to be a man. You're no good at being a woman. I'm able to turn around and I'm able to say, well, here we are. Everybody's calling me Katie. It's too late to turn around now. And that was actually a huge help. Everybody at church calling me Katie, even when I hated it. I didn't want anybody to call me Katie, but everybody did. So I think that's enough about me. All right, let's do this. Let's open it up for Q&A. Yeah, I think that's enough about me. If anybody here has any questions, family members you're concerned about, I'm going to do probably about 30, 40 minutes. Is that reasonable? 30, 40 minutes. I'm going to take as many questions as I possibly can.